Hi, I'm Dr. Daniela Stein. I'm a medical doctor and a wellness expert. I have a wellness clinic in Canada, and I'm the author of the international bestseller, Thrive Through Menopause. So I'm creating these videos to help you to thrive through menopause. And I'm going to, in this video, discuss chapter 2 of my book, Hormone Therapy, to treat or not to treat. So hormone therapy is essentially increasing your hormone levels of estrogen and progesterone. When we go through menopause, our hormonal levels change and slowly decline, but generally for most women, it's not a slow decline. It's less and then back in less and back up again. And it's kind of this, some call it a hormonal imbalance that really causes our symptoms. So the way we treat this typically is with, if you do choose hormone therapy, and you don't have to. So every person is different. I can't tell you on a video whether you need it. I can tell you about your options. You can have a look at the North American Menopause Society. They just rebranded it as menopausal.org for their guidelines. I personally am in Canada, so I use the Canadian guidelines, which are similar, where we say that we don't have to test hormone levels. We treat depending on symptoms. So I know many of my patients like to be tested for their hormone levels, and you surely can do that. And there's different types of testing, blood testing, urine testing, saliva testing. But our guidelines really are to treat according to symptoms. Because if your estrogen is really low, but you don't have any symptoms, you don't have to treat it. Unless, for example, you had a surgically induced menopause before 40, then your doctor will tell you to please take estrogen at least for 10 years to protect your heart health, to protect your bone health. There are so many benefits of hormone, of estrogen, and if we do something as doctors to put you into menopause earlier, then we want you to still have that benefit to protect you against heart disease and osteoporosis. And there's increased risk of Alzheimer's disease and dementia, so there are benefits, but there's certain indications, and your doctor will tell you if you're one of them. If you're someone who's on the fence, do I need it or do I not need it? What are my options? That's really what this book is about, is all your different options. So typically, when we do prescribe hormone therapy, it comes in the form of estrogen and progesterone. Those are our most known female hormones. Different forms that we can give it in. Estrogen, for example, comes as oral tablets, or it comes as, same as birth control, estrogen is an oral tablet, but then the dosage that we give for hormonal therapy is a much lower dosage than what we give for birth control. Then you can get a cream, or you can get vaginal creams specifically for vaginal symptoms, or a general cream that you apply to your thighs to be absorbed in the whole body. We get patches, we get gels, we get implants. So there are different ways that we can give estrogen. And then same with progesterone, can come as a tablet, or it can come, we sometimes give an intrauterine device that has progesterone in it, which helps to keep the endometrial lining thinner of the uterus to help to prevent uterine cancer. So typically if you still have a uterus, your doctor will recommend progesterone to protect you from endometrial cancer, but then also progesterone helps you sleep better in combination with the estrogen. Whereas women who does not have a uterus, if they've had a hysterectomy, if they are interested in hormone therapy, then they might get an estrogen only preparation. Then the exact dose is really something that you'll talk to your doctor about to find your right dose. We typically start with the lowest dosage. Then there are people often ask me what's the difference between bioidentical hormones. So there's different forms of estrogen. First estrogen that we had back in the day was equine, where you could get estrogen from horses. We since have newer synthetic hormones that are made in a factory, so we don't have to get it from a horse or a human. Then we have what people call bioidentical, and it just means that biologically it is identical to the estrogen in your body. Then there are many FDA approved formulations that we can buy over the counter, not over the counter, but what a doctor can prescribe to you that you can buy at the pharmacy, pills, estrogen in a gel form or a pump form that you can pump, 1 pump, 2 pumps. But then some doctors prefer to prescribe, or some patients prefer to be prescribed compounded hormones, where your pharmacist you'll take your prescription to the pharmacist, and the pharmacist will mix the individualized dose of estrogen into a cream for you to apply every day. So that's really, and I've also found in different countries, there's different ways that people prescribe it and that people prefer to take it. I personally follow the North American Menopause Society guidelines. I follow the Canadian guidelines. But all the options are in my book in chapter 2 of what you can take. The bottom line is really, it's very individualized. To everyone will need it different. Everything that you need to know is here in chapter 2. I actually revised the chapter a couple of times with my editor's advice to not make it too nitty gritty. Just short, what is it about, so that you can just get a good overview without going down deep into science. And then chapter 3 is in the next video. Please watch the next video for chapter 3. This is what I'm most known for. I'm known as a holistic doctor, and I discuss the approach that I use and I've used with so many women to help them thrive through menopause, and that is called the whole body approach. So watch my next video where I'm going to discuss the whole body approach on thriving through menopause.